Over the last 24 hours, we have identified 1,429 new cases of COVID-19 and completed about 15,000 tests. Our positivity rate currently stands at 9.4%. There are now active alerts or outbreaks in 414 schools, which represents 17% of all schools in the province. There are now 340 people in hospital being treated for COVID-19, including 83 in the ICU. Sadly, 3 new deaths were reported to Alberta Health in the last 24 hours. We have identified 717 additional cases of variants of concern in the last 24 hours. Variants currently represent about 45% of our active cases. To date, 3 variant strains have been detected in Alberta that have us concerned. The B117 variant, first reported in the UK, the B1351 variant, first reported in South Africa, and the P1 variant, first identified in Brazil. These variants are still new, but what we know from current evidence is that these 3 variants of concern are more transmissible than the earlier form of the virus. The good news is that all 3 vaccines we currently have available are effective at stopping the variant that's most common in Alberta, the B117. Evidence is less clear right now about the other 2. Vaccines seem to have a somewhat lower effectiveness against infection with B1351 variant, although they still may provide protection against severe outcomes. For P1, evidence is mixed, and it isn't clear whether there will be a vaccine effectiveness impact. The most important thing that we can do is to be vaccinated as soon as we are eligible. The best way to limit the long-term spread of these variants and all COVID-19 is to book our vaccines as soon as we are eligible. While research is still ongoing to understand how vaccine effectiveness may differ with variants, we know that every vaccine provides more protection than no vaccine at all. Limit your time in contact with other people, especially indoors. The new restrictions announced last Tuesday will bend the curve even for variant strains if we all pull together.